Michelle Graves, your host on The Power of Money, and I'm honored to have you as a part of my world in this coming segment. With The Power of Money, as you know, we are interested in three things. First, that you get the necessary education so that you and your family will have the information to do well in these difficult times. The second thing I'm interested in is for you to be empowered to prosper. I want only the best for you, but you can't get that if you don't have the education and then the drive to make it happen. And the final thing, and perhaps the most important thing, is that you be energized. Because life is more than a journey. Life is about living. And so I want you to learn these things and to be empowered and encouraged and energized. I'm Michelle Graves. Now here we go. I'm Michelle Graves, and again, thank you for being a part of this very special broadcast on Medicare Basics. We're going to move into Medicare Basics Part 2 shortly, where again, I'm going to be encouraging you to be a part of the financial boot camp for seniors that is being hosted by the city of Trotwood, Ohio, and I will be your host for this amazing experience. But in closing, if you want to register, and you should want to, go to the website www.powerofmoney.tv or call my 800 number that is showing on the screen below. Thank you so much. God bless you, and wishing you the best during this enrollment period. I love my seniors. Take care. And welcome to today's segment of The Power of Money. I'm your host, Michelle Graves, affectionately known throughout the United States for the last 30 plus years as the Money Lady. And if you are a regular viewer, and I'm pleased to say that we have many, many, many people that are faithful to watch the show and to give me response, emails, and communications, then you know I have had a commitment to educating individuals, consumers, about the world of money and finance, including real estate, insurance, investments, and bringing you the very best of the best in this industry, talking to them, sharing things that you'd like to ask but may not know how to frame it. So again, this is no exception. This is what I do. I've been a private practitioner for over 38 years. And I know a little bit, and I also know what I don't know. And I tell people in the world of money, you need to know what you know, but you also need to know what you don't know. And then you want to have resources and people that you can tap on that can help you and open up these areas that you don't know. So you'll know a little more than you knew before, but again, that's going to make you dangerous. You need to know that these are people that you can use for your own benefit so that you and your family can prosper. And you can leave a legacy for your grandchildren and great-grandchildren. It says that, these were wise people. These were thoughtful people. Today is no exception. We're doing part 2 of my conversation with Jeff Hendricks, who is an insurance agent who has specialized in the field of offering healthcare options for individuals, primarily seniors, through the Medicare venue. And last week when we interviewed him, I ran out of time. So I said, you gotta come back so I could finish the show, because Medicare is such a vital area in forward planning for retirement and seniors. And I would venture to say that Medicare stands right alongside Social Security and getting an understanding for seniors today, particularly the 78 million baby boomers, of which I am one, who are now stepping onto the scene in the area of healthcare as we age. So I brought back Jeff Hendricks again to talk about this subject, and without further ado, we're going to get into this because, again, I don't want to run out of time. I want to get this done, make sure you got all the information you need to make those decisions for yourself. Great success. How are you?
Well, I'm fine, Michelle. Good to be back again.
Oh, I appreciate your willingness to come back again, but we ran out of time.
Well, in order to put everything that I have learned over the years about how to prepare people for receiving Medicare benefits, it really is a subject that takes more than an hour.
I absolutely agree, but didn't that hour go fast?
Yes, it did. And we talked quite a bit about Medicare, the history of Medicare,
Yeah.
How Part A covers things that happens in the hospital and the skilled nursing facilities and the hospice care, and how the Part B of Medicare is the part that covers the doctor services, tests that happen outside of the hospital. And we talked about the evolution, a little bit about medical care and how that's impacted the coverages that are provided by Medicare A and B, and how over time, for example, Part A initially had a $40 deductible for going in the hospital, and that's $1,260 today. So from 1965 to 2015, that number went from $40 to $1,280. Part B had a whopping $3 premium and no deductible, and now today the premium is $147, and there is $104.99, and it's $147 deductible. Got those hundreds going on there,
Okay.
so those can be confusing.
Can we for those who didn't watch the first part, and I will also add, if the camera can come to me, for those of you that missed part 1, you can go to my YouTube channel, The Power of Money. Just type in Michelle Graves, The Power of Money, and by the time this program airs, if you missed part 1, whether you're in Atlanta or Ohio or Indiana or wherever, Michigan, if you missed part 1, you can also watch it on YouTube and get caught up. But can you just, for the benefit of our viewers, just go through what is Medicare?
All right. Medicare was signed into law in 1965. It was part of the Lyndon Johnson Great Society. But Teddy Roosevelt, clear back in 1912, had a vision of being able to, the government being able to provide the essentials of health coverage for its American citizens. So that is something that had been, I guess you would say, on the back burner, and President Kennedy wanted to fast track it, and then when he died, Lyndon Johnson basically got the legislation passed. And again, Harry Truman was the first recipient of the first Medicare coverage,
That's amazing.
which was symbolic.
Yes,
And,
I think so. He was the great president.
And the first coverage that was provided actually was Aetna. So from 1965, when, as we talked on the first episode, most things happened in the hospital, and the Part A of Medicare was the driving force. Back then, if you got sick, the doctor maybe came to your house. They certainly weren't ordering you up to have an MRI at an outpatient facility. So things were simpler then, and the needs of Medicare in order to provide for our citizens has changed over time, and there has been, since the passage of the Affordable Care Act of 2010, there have been a number of things that have been done to strengthen Medicare so that going forward it's something that we can count on.
That is very, very, very important, because under Medicare, you have to be age 65.
That's correct.
Okay.
Unless one has certain disabilities that qualifies one for Medicare prior to that.
Okay.
For most people, it is an age 65 event.
Okay, got it. So we talked about Part A, which deals with primarily hospitalization.
Correct.
And then we talked about Part B, which primarily deals with doctors, correct?
Doctors, anything that happens outpatient, even things that happen in the hospital that are considered to be on an outpatient basis.
Okay.
Those are all part of the coverages provided by Medicare Part B.
And then Part D, which was?
Part D, which is prescription drug coverage, which
Oh.
was brought out in 2006 by President George W. Bush and was offered by private insurance companies. And to this day, the Part D prescription drug coverage has been strengthened, has been revised, and has been crafted by the Centers for Medicare and Medicaid Services, working with the insurance companies to provide the coverage that people need.
Okay, and that's Part D.
Yes. So The question is, what if there'd been no Part C, which we're going to get into? Would drug coverage have been instead of Part D for drug, which sounded pretty natural? Would drug coverage have been Part C? Maybe so.
Maybe
because
so.
Government likes to keep things going down in that sequential order. However, in 1997, the Balanced Budget Act created a type of Medicare which is known as Medicare Advantage today. It's the alphabet letter is Medicare Part C.
Okay.
And
C as in cat.
Yes, and in its infancy, it was called Medicare Plus Choice. Now, why did the government, after already having Medicare Part A and Part B, why in the 90s did they decide, after 30-some years of Medicare coverage being around, why did they decide they needed something different, Michelle?
I have no idea. This is the government.
It's also the, yes, that's true, and it's also the evolution of medical care as it has been received in our society.
Okay.
For example, back when Medicare was originally designed, one of the things that they wanted to make sure of was that the government was on the fast track of paying providers for participating in Medicare.
Okay.
So the rule was 10 days, Medicare will pay your claim. So when doctors or medical equipment providers submitted bills, they knew that they were going to be paid
in 10 days.
In 10 days, not in 90 days,
Okay.
not in 120 days, not when they got around to it, but within 10 days.
Wow.
So, because of that, as things started happening in the Medicare field or in the medical field, there was a lot of differences between the bills that Medicare was receiving for the exact same procedure, whether it was from a doctor
Wow.
across town or across the state. If one doctor billed $400 for a procedure and another doctor billed $800, or if it was $2,000 and $4,000, Medicare had 10 days to pay that bill. So those bills got paid.
Okay.
So because Medicare, on the back side of that, did their audits and said, hey, we don't have any uniformity in how we pay our providers for services, which can be, as I said, even across town, there can be a big difference. Without any standardized, computerized coding and all the things, the niceties that exist today, the government looked at what insurance companies were doing, as in the 80s, insurance companies were forming networks where they were getting contracts signed with doctors and with hospitals that said, hey, if you're going to have your rotator cuff repaired, it's going to be this much we're going to pay whether you're over here or whether you're over there. There were certain geographic constraints, but the idea of having a level reimbursement field appealed very much to the government because, as always, using taxpayer dollars wisely is an important thing for our government to do.
And I think the standardization of charges would make the administration of payment easier, wouldn't you think?
Oh, exactly.
Okay.
Exactly.
Okay. Okay.
And as many things in our society have evolved over time, many times they start in Eureka, California.
Yep.
So there were what's called pilot demonstration programs that our government was doing in conjunction with Kaiser Permanente was the name of the company in California. Those projects were starting as early as in the mid-'80s.
Oh, my goodness.
So by the
I didn't
time
know.
the Balanced Budget Act of 1997 came into being, there was enough track record for the government to say, we want to move forward with this on a national basis. So Medicare Plus Choice, which is now known as Medicare Advantage, was officially born in 1997.
Okay.
Now, these Medicare Plus Choice plans were a private option provided by insurance companies, and they had attractive add-ons. For example, prescription drug coverage, which had previously didn't exist. Prescriptions were now being covered under these Medicare Plus Choice plans. So whereas Medicare Part A covered the hospital, Medicare B covered things outside of the hospital, but neither one of those picked up any coverage for prescription drugs.
At that time.
Yes, at that time.
Okay.
The Medicare Choice plans offered that to the consumer. And what Medicare said to the insurance companies when they allowed them to market these products was, we want you to give people more than original Medicare. Thus, the term of Medicare Advantage came about.
Gotcha.
Now, between 1997 and 2003, there were a lot of things that went on in the area of Medicare Advantage plans or Medicare Plus Choice plans. There were plans all over the country. There were plans in the country. There were plans in the city. The Medicare Modernization Act of 2003 changed the names from the Medicare Plus Choice to the Medicare Advantage plan, and also set some new standards for the insurance companies.
And that was in 2003.
And that was in 2003. Now, if you fast forward to today to see how the Medicare Advantage plans are operating, in 2014 there were 94 Medicare Advantage plans available to Medicare beneficiaries in the state of Ohio, and only 29 in our southern neighbor, Kentucky.
Okay.
What that points to is the fact that over time, it has been proven that the Medicare Advantage plans work best in an urban setting where you have the highest concentration of Medicare beneficiaries, doctors, and hospitals. Those are the areas that the Medicare Advantage plans have the most cost-effective and efficient administration. Also, the numbers that are there allow for more attractive plans. When the insurance companies were offering these plans in all different areas of the country and some of the rural areas, there was difficulty in the plans being cost effective.
Okay.
So over time, the plans that were available in the rural areas have been curtailed in a lot of instances simply because they were not as effective as original Medicare A and B in those areas.
So let me ask you a question, and that is that based upon what I'm hearing you say, the Medicare Part C has proven to be most effective in large urban areas.
You could say city.
Well, I'm
Part
going
C
to say
for city.
C is Part C. So you're looking at Atlanta and Nashville and Cincinnati, Dayton, Detroit, these areas where they have large senior populations as well as hospital networks and doctors. Is that the profile that we're looking at?
That's exactly right.
Okay.
And the idea of the Medicare Advantage plan, again, to give people more than original Medicare.
Right.
The Medicare Advantage plans followed pretty much the type of commercial insurance, and I say that's business insurance, that employers were providing to their employees.
Okay.
So for people that were coming to the age 65 point, who had had a plan from their employer, which had co-pays for doctor visits, co-pays for being in the hospital, co-pays for outpatient procedures, the transition from a plan like that at work to a Medicare Advantage plan was oftentimes easy for people to
Right, because they're
to get a
familiar
grip
with it.
on.
Yeah,
Yes.
they're more familiar with that type of a plan.
When those type plans were made available and explained to people and they were already used to it, it was a good fit.
Now, price-wise, and I'm sure that you as an advisor have done some comparative analyses, would the Medicare Part C for city be more cost efficient?
And Michelle, that is where, like many things in life, it depends on the circumstances.
It depends on the circumstance.
A simple way of looking at it is the original Medicare A and B is pay whether you go.
Okay.
Because you're paying ongoing premiums for the benefit of when something happens.
It's a group type of a concept.
And when something happens, the Medicare A and B plans typically have less risk as far as out of pocket because you're paying a premium every month.
Right.
So you've got pay whether you go to the doctor or not, which would be a simple explanation of Medicare A and B, versus pay when you go, which is the structure of most of the Medicare Advantage plans. For many years, Medicare Advantage plans charged no additional premium beyond the $104.99, which is the current going rate for most people for Part B. And the success of the Medicare Advantage plans, in 2014 in Ohio, 38% of the people that were Medicare beneficiaries, 38% were enrolled in Medicare Advantage plans.
So let me ask you a question, if you don't mind, and that is that under the Part C, you get your prescriptions.
Many of the plans do cover prescription drugs.
None of
You're
them
correct.
do. Is there a copay or a deductible under the Part C?
It varies
It
by
varies by
plans.
the plan. Oh my God,
So,
Jeff, this is confusing.
well,
how does one make a determination? Do you do a spreadsheet? Do you do an Excel spreadsheet?
Once again, when it comes to these things,
Okay.
as a consumer, working with someone who has been around the block in this area of coverage can be very helpful. Now, companies have seminars for people to come and receive information in a public setting, but many people, when it gets to the nitty-gritty, like, well, I don't really want to talk about the drugs I'm taking. I don't really want to talk about my conditions, but I'd kind of like to know about them, how the plan's going to cover it, what my prescriptions are going to cost. Those things oftentimes are best handled on a one-on-one situation with an agent.
But can I say something?
Absolutely.
There's 78 million baby boomers.
Yes, there are.
There are not 78 million agents.
And you are absolutely right.
And to be able to do a fair comparative analysis, which would have to be done with a person such as yourself, the numbers just boggle the mind. And of course, I can say selfishly, well, that's their problem, it's not mine, I'm going to get mine. But the reality is, in terms of implementation, how can this be a successfully executed program if you've got so many what-ifs and caveats?
Well, for some people it's the luck of the draw. And,
oh, man.
Medicare.gov is available for people to enroll in any of the plans that are available in their area.
Really?
On the Medicare.gov website.
They can enroll right there.
Yeah, and there's a plan finder, which allows someone to put in their zip code in their county, and it will show not only the Medicare Advantage plans that are available, but the prescription drug plans that are available to assist someone in looking at it and saying, okay, on the Medicare.gov site, there's information about the star ratings, which are the rating systems which we'll talk about shortly. There's information about if the plan has an additional premium.
Beyond what you're paying
Beyond
monthly.
the original Medicare Part B. It'll tell whether it covers prescription drug coverage or not. It will tell co-pays for doctor visits, co-pays for hospitals. So there's a lot of information that is available on the Medicare.gov site. But when it comes to spreadsheets,
yes,
Medicare does not, because of the differences between the plans, we have to present each product separately so that you can see the benefits of each without laying them all out and saying, okay, da-da-da. And that is a process that takes a little bit longer time than if one could just print out a spreadsheet and say, okay, here they are. And the reason they don't is because each plan has nuances which do not readily lend themselves to a spreadsheet comparison. And that's where, when you're dealing with someone that knows the ins and outs of each plan, it really helps. And it's difficult because most companies will employ agents that will talk about their specific plans.
Only,
yes.
I don't like that.
Well, I understand why the companies do it, because
course
there
I
are
understand
78
why.
million people,
Yeah.
and they want to get it. They want to offer every available
Right.
avenue they can, whether you enroll on Medicare.gov site, whether you call the company direct, whether you send in an application from something that they mail you, or whether you speak with an advisor like myself who has been through the process of being certified with multiple companies so that I can speak intelligently about them and speak legally about them.
I was going to say.
Which is an important part of the process that the Centers for Medicare and Medicaid Services uses in order to allow for information to be given, but making sure that it's given in the right manner. There are definitely many hoops that we as professionals offering coverage for people who are looking for their Medicare options. There are a number of hoops that we have to jump through, which makes it more professional and perhaps keep some people that might not have the same level of passion for the product
And integrity.
Yeah. To get involved.
Yeah.
It keeps a lot of people out. Now, what has been happening in those Plan Cs, one of the things is, since 2013, many of the plans have increased the what's called maximum out-of-pocket, which is a financial protection number. Remember when we talked about Medicare Part B, and I said Medicare Part B is a plan that has co-insurance,
Right.
meaning the government participates
And
80% of the claim, the individual pays 20%, but there's no point where that 20% is done.
Right.
You could pay 20% of whatever the number is, whether it's $400,000, that can be an expensive 20%.
Yes.
So, with the Medicare Advantage plans, they have a what's called maximum out-of-pocket.
Okay. A cap.
A cap.
Okay.
Those numbers now vary between, I've seen as low as $3,200, and the amount that Medicare recommends as their cap is $6,700. So, looking at a Medicare Advantage plan saying, hey, I'm going in with a zero premium, I've got a $10 or a $20 or a $25 primary care copay. If I go see a specialist, I'm paying $40 or $45 or $50 for a copay. Those copays go towards that maximum out of pocket, but those maximum out of pockets in the calendar year, as I said, have gone from they were in the 3,000 to 3,500 range, and now, like I said, many of them are 6,700. So when you look at which is more cost effective,
Right, because people are going to make value judgments.
Right.
Right.
One turning 65 could say, well, hey, I'm going to spend somewhere between $170 and $200 a month for a Medicare supplement and a prescription drug plan, versus here's a Medicare Advantage plan that has a zero monthly premium but has a $5,900, for example, maximum out of pocket.
A year.
I could spend $5,900 if I had the absolute worst medical year. If I have a typical year, then maybe my expenses are, $100, $200.
But can I ask a question, not to interrupt, because I've got a number of questions that I'm looking at. The thing that comes to my mind is we know, and I know that the government knows this because they have specialists, as a person ages, their health continues to deteriorate. That's a normal part of the body. Aging, things begin to happen with more frequency and with greater expense. So if you have, if you do just a part A, B, and D, and you take a small Medigap plan, your out-of-pocket may be less than going into I could see the C plan being skewed toward people that have greater probability of having health conditions, and then they have coverage for that whole, so to speak, that $6,000 whole. Is that what's happening today?
What's happening today is people make determinations for their coverage based on what they look at their individual health history, and for some people who have been blessed by God with great genes, their expectations of their future health needs being minimal based on their prior history will lend them to look perhaps more towards the Medicare Advantage plans due to the fact that, again, it's pay when you use it versus pay
I got it.
whether you use it.
Whether you use it, okay.
So for some people, the idea of, hey, I'm going to budget this much for my Medicare AB, my prescription drug coverage Part D, and I'm going to buy a Medigap plan. I'm going to pay those premiums every month because I like the security of knowing that if something comes up, I'm not going to have a disruption in my financial affairs.
Right.
Then there are other people who either are blessed with the health or they perhaps are blessed with the finances, which allows them to say, I'll take that risk. If I have a bad year, this is a mess it's going to cost me. And again, some of the plans still have $3,900 maximum out of pocket in a calendar year. And if one is looking at that as a maximum out of pocket, and
that
they're
you can
figuring-
self-insure
and
for.
they're figuring, well, hey, if I go the tried and true route, I may spend $2,400 a year and not use any of it.
Right.
Whereas
I got it.
Got
I
it?
see it. I got it now. Okay.
Yes,
So it is a cost-benefit comparison.
Yes, it absolutely is. It's not something that we can sit down and spreadsheet, but we can discuss how different claim options would be paid under a Medicare Advantage plan versus paid under a Medicare Supplement plan. And again, with the Medicare Supplement plans, one can buy varying levels of coverage.
Okay.
So the options are all over the place for Medicare beneficiaries, which is good.
Yes, but it's very confusing, Jeff.
Well, yes,
Yes,
it is.
it
And for
is.
many people, again, for people who have worked for a company and they've had companies got full-time people that do nothing but,
Yes.
but arrange for coverage and make sure that that coverage is being implemented. Now, someone turns 65 and you get to be that person.
Oh,
you get
thank you
You get to
so
now
much.
figure out, you know, do I want to get my insurance license or do I just want to get this coverage?
Right.
Because
I'm not, literally, do I want
Yeah.
to get an insurance license or do I, oh,
so,
please.
So for some people, it's not a daunting task and they're competent and they move through it. And then there are other people that when the Medicare and U book comes
my
each year,
God.
which is about this thick, which has all kinds of information about Medicare, about plan options. It sits on the coffee table along with
Fuzzes
the other
over.
literature.
You
and they
glaze
say,
over.
okay, what am I going to do? And for people that pick a plan, many times they'll stay in that plan unless there's really a big disruption because, my gosh, I had to go through what I had to go
Right,
through to
the
figure
pain
out what I was doing the
association.
first
I
time.
mean, geez.
And I meet with people, then they agonize, and they start 6 months before they're turning 65 getting information. And I had a phone call yesterday from someone who says, I just want to make sure because this is an important decision and I want to get it right.
Well,
So-
see, that's where I guess my angst is, just as a professional, because there are too few people like Jeff Hendricks. Come on now. There are too few people that are licensed, because you have to be licensed.
And certified.
And certified. And I don't have any interest in doing that. This is too much. I mean, but given the numbers of people and the real expectation, how does one make practical, sound decisions when everybody's situation is different?
And that's when...
And then you can't even charge.
And
I
we
d-
do receive a fee that's paid by the insurance companies. I'm
Yeah.
glad you brought that up.
Okay.
Because there have been companies that charge people $100 or $150 to
Assess.
to assess their situation. They give them then, oh, you could take this, you could take that, you could take this, you could take that, 5 or 6 choices. They've spent $150 and they've still got 6 choices that they've got to
That they gotta make
figure
anyway.
out. And you know, so spend zero with an agent who is licensed with multiple companies who
And
can help you
certified.
make those decisions. Yes, and of course the certification process, which while many people will be doing other things in July and August, agents that are going through the certification process to be able to offer these plans, because the plans start 10/1 as far as the period of time when we start moving people into the 2016 plan information and helping people make changes from 2015 to 2016 plans. We'll be sitting in front of a computer July and August doing all this
the stuff,
certification.
yeah, trying to
which is, that's what it takes to do this job.
Wow. That is so absolutely mind-boggling. And I say this because subconsciously and consciously, I am dreading, and that's 2 years from now. I have to make those choices. And frankly, I'm not going to do it. I'm going to call you. I'm just not. Because it's too much. It's too much.
And the thing that might be right for you if you were 65 in 2015 may not be the right thing for you in 2017.
My goodness.
That's where, as consumers, every year you
Something
have the
changes.
possibility of your plan either getting different that's good or different that's not good. So, quality of the Medicare Advantage plans is something that the Centers for Medicare and Medicaid Services are very focused on making sure that providers, that insurance companies, that hospitals, that doctors, that nursing homes meet the grade. So the star rating systems have been developed. They actually started in 2007. And the star rating system is a system by which the government gives each of these, the nursing homes, the hospitals, the doctors, the pharmacies, the insurance companies, gives them guidelines. And measurable and scorable. And the results of the star ratings have a lot to do with the Medicare Advantage plan receiving funding, receiving less funding, receiving more funding. So the name of the game is, if we can deliver the goods, we're going to have more money to make our plans even stronger. So what you're seeing in the marketplace is, in 2009, only 17% of the companies were meeting the 4-star or 5-star level of star ratings. In 2015, 60% met the 4 or 5-star ratings.
Oh, that's an incredible shift.
Well, when the government says, you know, we're putting our money where our mouth is, and what our mouth is saying is, you need to do these things. And all of the things for the star ratings are designed to improve the quality of care that our Medicare beneficiaries receive. Because the higher level of care, the better health, the better outcome, the less expense it is to the taxpayers.
That makes good sense. Now, my question, of course, on the star rating is this what are the criteria? Can we look at the criteria to determine how they rated them?
Yes, there is information available on Medicare.gov.
Okay, that's there.
Yes, and some of the most important parts of the star ratings as respects the insurance company Medicare Advantage plans is, are people getting their preventive tests? Are women getting their mammograms? Are men getting their PSA tests? You know, are people getting their cardiovascular tests? Are they watching their A1C, watching their sugar levels? Are people getting a glaucoma test? Are people getting their flu shots and their vaccines? So Medicare has such an emphasis on this that the preventive services that are covered by Medicare at 100% include the things that we're talking about. Screenings for diabetes, screening for glaucoma, screenings for the cardiovascular. So the Centers for Medicare and Medicaid Services says, okay, insurance companies, here's what we've got for you to work with. Here's the things that we would like you to do. And then the insurance company's job is to deliver the goods by encouraging their members to make sure that they are aware of their tests that they can get. And insurance companies also have been able to incentivize those by, believe it or not, offering rewards. So when
the insurance company will offer a reward for you getting a mammogram?
Okay, let me give you an example, not mentioning the insurance company. For people that go get their annual wellness checkup, which is a meeting with your doctor where the doctor discusses the different preventive services that are available and picks out the ones that you need to focus on, you can get a $15 reward card that'll be it'll be to they had Starbucks, they had Subway, caffeine even. They had Subway, they had Amazon.com.
Yes,
I mean,
they traditionals,
say, go see your doctor. There's no charge for the visit, and we're going to
will
reward
give
you with a $15 reward card once we have evidence in our system that you have completed that. So the importance of these screenings, the importance of the screenings is so high that the insurance companies are incentivizing people because let's face it, people like getting rewards.
Oh, they do.
We are reward
we
driven.
love those
Yes.
little plastic cards from gas on up.
You
So
got it.
the government will rate. Let me just summarize. They have a rating system. A 4-star, did you say?
4- and 5-star plans are
Okay.
the plans that receive the highest degree of funding, which
Yes.
in turn allows them to provide more benefits for their members. There is a system of determining when you, as a Medicare beneficiary, are eligible to enroll in a plan.
Okay.
And these enrollment periods have been highly defined by Medicare. For most people, October 15th to December 7th is the period of time each year where one can make a change in their Part C Medicare Advantage plan or their Part D prescription drug plan for the following year. For most
Those
people,
two things. Okay.
yeah, for those, for Part C and Part D, most people have from October 15th to December 7th. That's a lot of people making changes in a short period of time. But for people that miss that window of opportunity and they
Yeah.
find out at the beginning of the next year
Yeah.
that, oh, there was an annual notice of change booklet that came out in September from the insurance company. It was about this big,
yeah.
had all the changes in it. Didn't open the book, still got the plastic wrap around it, didn't know that the plan was going to have a premium for the following year. I get the phone call, how come this plan now has a $45 premium when it was, well, this was free? Well, first off, we don't use the word free. We say it was zero cost, sir, but
Right.
yes, it does now have a $45 premium. Well, what can I do? Well, if you're in a Medicare Advantage plan, you have a period of time from January 1st, February 14th to go back to original Medicare. Once again, all of these timelines.
I'm
and
listening to
all
these
of
timelines.
All of these specifics that are do's and don'ts are things that, for the layperson, it can be very confusing. And for someone like myself, we have to be on it as far as knowing, for example, the 36 different special election periods that void those periods, that give people an extra opportunity to enroll in the period that is outside of
The open enrollment.
Yeah, the open enrollment period.
So if it's outside, you can go out of your C plan to the general plan. But you
Depending
can't
on-
go from a C to another
Well,
C.
yeah, it's confusing. You can go from a C to a C, or you can go from a D to a D in that open enrollment period. But in January, you can go from a C to an A and B in a Medicare supplement and a Part D. And before your head starts to explode, I will just say that the 5-star ratings, there's not a company in our area that has a 5-star rating yet, but the first company that gets the 5-star rating will be able to offer their plan year-round. So that
Really?
if someone is in a plan where there's a change that they're not comfortable with, at one time a year, once a year, they can elect the 5-star option and change to
That
company.
company.
So
But they're
what
not
kind of
in-
incentive is there for insurance companies to get to 5 stars is what I want to know.
Major.
Big. Yes,
Major.
big time.
Major. So
Big time.
let me, but you say as we speak, in our area, there are no 5 stars
At this time.
at this time.
And whether there'll be one for 2016 is stay tuned.
I will stay tuned. I will stay tuned. This is still, and I understand what you're saying, and I understand the role that you play in terms of sorting out all of the fine print, because coming out of banking and insurance and finance, people have credit cards where they've never read the print. People sign mortgage documents where they never read the fine print. Excuse me, you sign those documents and
They just keep coming
and
at
they
you.
just don't. They just keep coming. They just keep coming. Sign, 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 and then you go back and you're like, holy moly, I signed that. And it just seems to me that, and I'm not a government official or anything like that, but it seems to me that there is an absence of equity here. You can't make prudent decisions if you don't have an understanding of what the decision is.
That's a very good point. That's a very good point.
Well, I appreciate you saying it's a good point, Jeff.
Well,
saying it's a good point.
You know what I'm saying. I agree with you entirely
Okay.
because I've seen the backside.
Okay.
I've seen like I said, the person that finds out in January that they've got a premium. The person that finds
Now,
out.
how do you write a check to them? How do you find that you have a premium?
You get a bill in the mail and you say,
get
all
a
of a
bill in
sudden,
the
wait,
mail.
well, wait a minute, I don't, and sometimes it's, oh, that can't be right, and pitch it, and
Oh,
then the next month,
no.
instead of 45, it's 90, and
Oh,
then
no.
3 months later, it's, Jeff, do I have to pay this $270 that they say I owe?
Yes, you do.
And that's not something that someone wants to get caught in. So once again, the annual report that comes out that tells about the changes that the plans are going to have for the upcoming year come in September.
That's in September
So
of
in
that.
September, it gives you as a Medicare beneficiary an opportunity to say, okay, I got this big book here, let me open it up. The changes are supposed to be in the first few pages. Let me see if I can make sense of this. Uh-oh, it's losing me. Better call Jeff or better call who it is I'm dealing with and ask them what the real skinny is on what happened to their plan. Is there another plan that fits their needs better? Those are the things that we have to be on top of, but we can't reach out to the people to the extent that some people would say, well, why didn't you call me? Why didn't you tell me? Well, we've got from October 15th to December 7th for everybody. So agents send out letters, agents send out postcards saying, hey, annual enrollment period, open enrollment is coming, you know, please contact us if you have questions about your plans. But you know how people get so much mail.
Well,
so it's in the
yeah.
consumer's defense, I say, people think, I just looked at all that last year.
Yeah.
Don't make me do that again.
Exactly. Torture is not fun.
But that is it's just a watchword, you know. Just as you are trying to watch your business, you got to watch those Medicare plans each year to make sure they still meet your needs.
So, absent a clarity of understanding about documents that look intimidating and read governmentalese, how does one, absent of yourself, and I say this in no disrespect for you, but I keep thinking of all these millions of people who are like, ah, and then I look at you and you're a successful practitioner, a man of honor. How does this get worked out? I mean, you have a wife, you've got a life. There's a limited capacity for numbers of people that need your help.
This is where the system set up as it is makes it difficult for everyone. However, with all the moving parts,
Okay.
with all the changes that happen in you know, over the course of a year, a hospital renegotiates their contracts with the insurance companies. That changes pricing. Prescription drugs change in price, and there are a number of new prescription drugs that have come out that are just extremely expensive. And because of the fact that, you know, we have the best healthcare system in the world, and because we are cutting edge, for example, there are new medications now that have been authorized, and the Centers for Medicare and Medicaid Services has said, this has got to be in the drug plan for 2015.
Okay.
A specific medication called Sovaldi, which is for the scourge of hepatitis C, which hepatitis C has had a resurgence due to the unfortunate drug use in our country,
Yes.
the IV drug use.
Yes.
So the cost of hepatitis C can lead to liver transplants, which are extraordinarily expensive. So the government says, well, let's make this new medication available to people that have hepatitis C. Well, the average cost of that treatment can be $80,000.
$80,000.
Yes, and that's just one of the types of medications that's being developed for specific, some of the cancer drugs, some of the immune system drugs.
Play this out for me. Play this out for me. You got a 68-year-old male with hepatitis C, and he is under the traditional Medicaid.
Whether he's under a Part D prescription drug plan that he's bought in conjunction with a AB Medicare supplement situation, or whether he has a Part D that is part of a Medicare Advantage plan, that 68-year-old who has this hepatitis C is going to be able to receive treatment under that Part D drug plan, an expense that previously had never been seen to the extent that it is projected to be seen. So
how much would he have to pay, may I ask? If it's $80,000 as expected cost.
Well, the prescription drug plans have a maximum out-of-pocket in the calendar year of $4,750 before you get to the point where the drugs are very cheap.
Okay.
So, you can say a $5,000 number is a maximum number for treatment that would cost $80,000. It's costing the member $5,000.
So now, but here's my question.
Yeah.
Okay.
How many of those can the insurance company absorb?
Exactly.
Yeah.
I'm a businesswoman, so are you. Nobody is stupid out here. So if the difference, the spread between the 5 and the 80 is $75,000, who's paying that?
Well, that's going to be an interesting situation going forward as these new medications are made available and the financial impacts of them being used in treatment going forward. How is that going to affect the prescription drug plan premiums? Last year, premiums went up for the first time that in some of the lower plans, the premiums went up 15–20%. Now, at the same time, there were some plans that were more expensive that came down in price. So the overall effect, when they look at the average cost, wasn't really seen to the extent that it could be in the future. So this is one of those we don't know.
We don't know, and I don't feel good. Well, listen, would you believe our time has run out again?
Well, we covered
everything.
C, we covered most of D. I will encourage you, if you are looking to, if you have a situation where you have a family member, maybe a parent that is going to be looking at nursing home coverage, Medicare.gov has a Medicare.gov nursing home compare on their website where they've got the ratings within your zip code.
Oh my goodness.
Of all the nursing homes. That's helpful. And my last thing would be for anyone who's making less than about $18,000 a year single or $24,000 married, you want to call Social Security and ask, or call an agent like myself and ask about extra help for their prescription drug coverage, because that is where people in our society who have not been able to maximize their retirement options and are living and they're just living day to day.
They literally are.
That's where people that have income at that area can receive help on their prescription drug plans.
Give us your phone number.
It's 513-379-4400.
Say it again.
513-379-4400.
Well, folks, here we are again. Session 2 with Jeff Hendricks on Medicare. And I want to encourage you to, again, if you've seen it and you want to see it again, check your YouTube channel and see if you can upload it. If you got questions, give him a call. I'm not going to sit up and tell you to give me a call because I'm just like you. I'm trying to learn this stuff too. And I got 2 years to figure it out, and time really does go fast. So I want to thank you for being a part of this dialogue about Medicare. Hopefully, in my viewing audience, those of you that have questions can email, and they can always call. I thank you for being a part of my world, as always, every week on The Power of Money. And in closing, peace, life, and lots of love. God bless you. You take care. See you next time.
I'm Michelle Graves, your lady on The Power of Money. I hope you've appreciated the information on Medicare Basics Part 2. Again, I want to re-emphasize that on September the 25th of this year, 2019, I will be at the administration building for the city of Trotwood doing the first of many, many senior boot camps to empower our senior population financially so that they are no one's fool. Maya Angelou said it best. When she was doing things she didn't know. But once she knew, she did better. I want you to do better. I want you to come to these classes. I want you to learn what's at stake for you. Medicare enrollment begins October the 15th and runs through December the 7th. I will see you there. God bless you. Talk to you soon. Bye-bye.